In Ontario, we have 3 categories of nurse that can be registered with the College of Nurses. So it's a nurse practitioner, the BSCN nurse, and the practical nurse. So we teach the practical nurse. It's 5 semesters, and it allows students to be registered with the College of Nurses as a graduate nurse and work with that title in Ontario. 5 semesters, which takes you through several academic courses, some science courses. It takes you through lab courses where we simulate the learning that you'll do in the hospital and the various healthcare agencies that we have. We'll then send everybody out to practicum for 2 days a week from semester 2, 3, and 4, and then in semester 5 you're out working with 320 hours full-time with a preceptor.
So I started with the practical nursing program because I've always loved helping people. I've always loved making them feel better and taking care of them, and I thought it would be a great way to kind of get a handle on it before I decided to go for my RN, my registered nursing. So it's a great place to start and make sure that I loved what I was going to do.
Well, the most enjoyable part, I'll say there are quite a few. One of them will be hearing the stories as the lecturers, share their experiences.
I loved going out to placement because you got to meet so many people from so many different backgrounds, so many different religions, so many different healthcare histories there, and it's so neat to take the skills you've learned in class and kind of apply them. So it was really interesting walking into a room and going to yourself, okay, I know this, I've learned this. So that was the best experience for me, definitely clinical.
We have the opportunity here at Durham College to have a very sophisticated simulation lab that offers virtual patients to our students to practice and have authentic assessment with that. And those virtual patients can be programmed to sneeze, cough. We can run a cardiogram through them. We can have them talk back to us. We can set them up for various scenarios for students learning in a very safe environment.
I started out as a pre-health student, and I loved what I saw. The lecturers were knowledgeable and they were also approachable, which was different from what I was used to. I could decide to go in for my master's in any other area. It's more or less like a foundation or a stepping stone to greater things that are out there for me.
Everyone here at Durham College is really going to help me to decide where I want to go. And they make you feel like anything is possible. So at this point, I'm not sure if I'm going to bridge, or I'm not sure if I'm just going to stay working as an RPN. But it's nice to know that with the help of the Durham College professors, all of that is still open to me and still ahead of me.
And they can work in community placements like visiting nurses. They can work on cruise ships. They can work in jails. They can work in the hospital in a variety of settings, from bedside nursing to emergency to day hospital, that kind of thing. So it's endless. It's really, there's lots of work in this field, lots of work. Success means that we're preparing students for the real world of nursing, regardless of the setting, and that they will be tomorrow's healthcare providers.